everyone. You're very welcome. This is our third QPS Talk Time of the year. Please do interact with us as well on social media, in particular on Twitter. And there's some Twitter handles there, and you can join the conversation there, both in the session and afterwards. Objectives today are really we're going to give you the opportunity to really explore the prospectus. We're going to hear an overview of the prospectus, what's in it, and how to use it, and the potential opportunities for identifying your own learning needs, and then finding things that meet them. And then obviously today, I think we also have the chance to both for you to meet members of the directorate and other colleagues who are supporting the prospectus. So it's a real pleasure to introduce Dr. Mary Browne and her colleague Veronica Hanlon. And Mary and Veronica are going to talk us through the prospectus. Okay, Mary and Veronica, thank you.
Thanks a million, John, and it's great to be here. And we're really delighted for this opportunity to share the prospectus on this session of QPS Talk Time. And I see just in the chat there where a number of people are joining because they just want to find out what's in this prospectus. And hopefully by the end of this session, people will have had a really good opportunity to understand the different programs that are included in the prospectus, and then hopefully have a lot more information on some of the programs that they might have a particular interest in. So this is our second annual prospectus, and I suppose our purpose in developing it was to bring together into one place the QPS learning programs and resources that are available across the HSC, and really to make it much easier for our staff, patient partners and students to know what is available in terms of QPS education and learning, and also how to access it. I think one of the really nice things that we're delighted about with this prospectus this year is the fact that we have colleagues from across Central HSC who have included their programs into the prospectus, and you'll be able to get to meet some of those colleagues through the different breakout rooms. So you can see there, certainly, there's a number of programs that people will be familiar with. So we have our quality improvement programs, incident management or open disclosure, clinical audit. So a lot of programs that people are probably aware of in terms of quality and patient safety. We have some new ones popping in there from human factors, our liberating structures and data for decision making. And as I said, colleagues from complaints, governance and learning, governance and risk, safeguarding, AMRIC, our colleagues within change and innovation, but also from the library services have all contributed to make this prospectus, I suppose, what we hope as useful as possible out to the system. So I'm going to pass now to my colleague Veronica, who led the development of the prospectus, and really, hopefully, Veronica is going to share with you and give you an insight into how the prospectus can support your learning.
Thanks, Mary. Hello, everybody. Great to see you all here this afternoon. So what I'm going to talk to you about is how you can use the prospectus from an individual, a team, and a leadership point of view. So just first of all, I suppose as individuals, we would hope that the prospectus will guide you to consider all the aspects of quality and patient safety that are relevant to your role. So as Mary said, this year the prospectus has expanded to cover all programs that are related to quality and patient safety in some way. It's always a good time of year to look at a document like this because it'll inform your professional development for the year ahead, and hopefully you might be having those discussions with your line managers. It'll also support you to build your quality and patient safety knowledge and skills incrementally. So what you'll notice as you flick through the prospectus is that we have a number of introductory programs, we have a number of foundational programs, and then we have a number of programs that are catered for people in leadership roles. So you'll be able to build on your learning as you take the various programs. And also many of our programs are eligible for CPD credits. So we apply for accreditation through the Royal College of Physicians, which covers all medical education, and then also the Nursing and Midwifery Board. For those of you in healthcare professional roles, we can provide certificates of attendance, and you can use those as part of your CPD portfolios. So from a team perspective, obviously it will identify knowledge and skill learning needs from a team. And there are a number of programs in the prospectus that are aimed at people learning and sharing learning together collaboratively. So for example, we've got our Improvement in Practice program, and we invite learners to come as part of a multidisciplinary team to that program. Likewise, our postgrad certificate in QI leadership in healthcare is aimed at multidisciplinary teams. We also have a number of small little programs that will support team development. So for example, Working as a Team for Improvement is a little e-learning program we have on HSE land, but it covers general team development as well as team development in the QI context. For those of you who might be in leadership or managerial roles, the prospectus is really good if you have a new employee coming to your team and you need to develop some sort of induction plan. Because a number of our programs are aimed at an introductory level, and then we have obviously our open disclosure programs, which are mandatory. So it's a really good resource to help you develop that induction plan for a new employee. Also, as part of the HSE's performance achievement process, professional development planning is a key component. And you may know, if you're in a leadership role, that you need to be sitting down with your staff at least 3 times a year to look at their development. So again, the prospectus can be a really good resource for that. It'll also support team learning and continuous professional development, as we said. And it can also support you in terms of dealing with maybe performance issues, or if there has been an incident and you need to look at maybe, reskilling or retraining of staff.
And thanks to everybody who's stayed with us and to, I suppose, hear and listen about starting a quality improvement journey. And we'll be very brief and just share you a little insight around some of the lovely QI resources that are available within the prospectus that could really support you in getting going on that QI journey. A couple of years ago, we produced the Quality Improvement Knowledge and Skills Guide, which really sets out the knowledge and skills that will support you in terms of building an understanding in QI, then incrementally moving to being in a position if you want to deliver QI programs and the knowledge and skills required for that, or if you find yourself in a leadership position and having an opportunity to influence a QI culture, the knowledge and skills associated with that level. So within that guide, what we did have then is that QI learning journey that has those 3 steps of building understanding, delivering on improvements, and then trying to influence a culture of QI. We've developed a number of resources aligned to that QI learning pathway. Veronica, you're going to walk people through.
Thanks, Mary. Yes, so at the very bottom of the pyramid there, we've got our Introduction to Quality Improvement. And this is a very short little 30-minute e-learning program. It just introduces people to the framework for improving quality. We have a little video clip from a patient and also a video clip from a staff member who was involved in a QI project. So it's a nice little introductory module. Building on that, then, we've got our Foundation in Quality Improvement. Now, it is a 3-hour e-learning module, but it's broken up into 7 little micro-learning topics. So it talks about the evolution of quality improvement in healthcare, and then it talks about the other 6 drivers for quality improvement. So we talk about how do you engage patients, how do you engage staff, what are the methods for improvement, how do we measure, what is the governance and leadership that we have. So again, they can all be taken at your own pace and your own time, and are available on HSE land. Going up the pyramid, then, we've got our Improvement Practice program. So this is aimed at multidisciplinary teams who have an improvement idea and would like to work on their project while learning about quality improvement. So it's a 20-week blended learning program. So we use HSE land to deliver some self-directed learning, And then we do virtual sessions and virtual clinics with the teams. And Mary's going to talk to that in a bit more detail. And then for those in leadership roles, we've got our postgrad certificate in quality improvement, leadership in healthcare. We run this in collaboration with the Royal College of Physicians. And again, this is aimed at multidisciplinary teams who have, I suppose, leadership roles, are involved in developing a culture of quality improvement in their areas. So they're the various programs that we developed in line with the pathway that Mary mentioned earlier. So just in terms of some of the introductory programs, if you want to get started on your QI learning journey, as I said, the introduction to QI and the foundation in QI are two good places to start. And then the little e-learning program that I mentioned earlier, Working as a Team for Improvement, that gives some really good tips around developing your quality improvement team and even, you know, how to run an effective quality improvement meeting. So they're nice little quick resources that can be used by teams at any time.
Thanks, Veronica. So as Veronica said, this is our 20-week blended learning program, again focusing on multidisciplinary teams, leading them through the step-by-step process of undertaking a quality improvement project. As you see, there's 7 modules, and of 70 weeks, our teams build up their knowledge and skills to be able to undertake, to apply their learning and through undertaking a QI project. Towards the end of the module, we do have a celebration event, and really just to recognise the achievements of the different teams. So this is the Improvement and Practice Programme is available, and content are available within the sectors. But I will say it is supporting local teams, multidisciplinary, who are keen to undertake a local improvement. So Veronica mentioned this. This is our postgraduate certificate in quality improvement. This is the 3rd step along our QI learning pathway. And many of you might be familiar with this program. This is our year-long program that's delivered in partnership with faculty on that program. Do you want to speak to it for a few seconds?
Yeah, so it's a 1-year program. Like you said, Mary, usually starts in September and runs through until June of the following year. And people apply and attend the course as teams of 3, and they will they'll come to we host the first 4 days of the program in person, and then after that it's a hybrid of online and in-person days. So it's about 12-13 day program, and half of those days are online. And at the heart of the learning, I suppose, is the teams undertake a quality improvement project, which is really there for them to apply their learning and to learn about how to do quality improvement. And you know, if they happen to improve something along the way, and many of them do have really great outcomes, but the main purpose of this is to teach people good quality improvement engagement skills, and to apply patient safety theory, quality improvement theory, and all the leadership ideas needed to support and sustain quality improvement.
That's brilliant. Thank you, John.
And to say the applications for that next one will be open around May, so to keep an eye, we'll tweet around that, and also keep an eye on our website.
So just to wrap up, there are a number of QI learning resources that are available on our website, again, to get you started on your QI learning journey. So the Framework for Improving Quality, that's a nice little resource that will just outline the 6 drivers for quality improvement. The Quality Improvement Toolkit is a really useful resource because that contains about 17 tools that you can practically use as you progress your project. And again, it's a really easy resource to use. With QI, as well as most things in the HSC, there's lots of acronyms and lots of terminology. So we've developed this terms and concept resource that will just get you used to some of the language that's used around QI and some of the terminology that you might see in our learning resources. So they're the 3 resources that are available, as I said, on the website, and would be really good just to get you started.
I suppose the last thing we wanted to show with this slide was really, I suppose, an intention that we have is to try and make it as easy as possible for local services who want to build up their own local capability. And as you can see, with starting on QI Learning Journey, Intro and the Foundation are available on HSE Land to everybody. We've designed the Improvement and Practice programme for local QPS leads, local educators to deliver it themselves. And I suppose our real hope there is that with some co-facilitation and support from us from a distance, that local teams will have access to all the resources supporting the delivery of the improvement in practice, and I suppose take real ownership for being able to support local teams to build up their QI capacity and capability. But I suppose what we've certainly heard from people around the system is that while they might have the QI improve and they struggle in terms of facilitating the delivery. So to try and meet that need, we've developed 2 new programs, and again, you can get further details of these in the prospectus. But there's a facilitator development program, which ONMSD, through their National Centre for Clinical Leadership, have allowed us to develop and deliver out to our QPS colleagues across the system. And that is a 2 half-day programme, and with the opportunity to practice what you learn in the programme. And the real aim of that is to support people to build up some good facilitation and engagement techniques if they were delivering, let's say, the improvement practice. The other programme that we have available is our Coaching for Improvement programme, and I think, Veronica, you're going to speak to that one.
Yeah, so I suppose the reason we developed this program is that there was certainly a sense that when teams maybe embarked on our Improvement in Practice program, they were going back out into the system and they needed to be supported either by their managers, their leaders, or some QI coaches or QI facilitators. So we designed this in collaboration with our HR colleagues. And really the aim is to support those people with the coaching and some basic coaching skills to support teams. So some of the core content of this program, and it's a 1-day program, is just, what is coaching? What is coaching versus mentoring? We look at some key coaching skills, explore the benefits in a QI context, and then cover things like active listening and powerful questions, and the GROW model, which is a fairly well-defined coaching model. And then participants have an opportunity to practice those skills in the afternoon. So again,
that's just a link and a QR code that will bring you up there to the prospectus, and I think people will have a much better idea, hopefully today, after the session, as to all of the things that are, it's an incredible amount of things on offer. And can I just be clear, Mary and Veronica, is there any cost here to anybody for doing any of these programs?
none.
Yeah, so
good news, John.
Yeah, no, it is remarkable, what is available, I think, for free. Obviously that needs to be, people need to be released to do some of these, but some of them can be done very conveniently as well. So well done. I think it's great to know, it's great to see everything under one heading kind of that's available. So really encourage people just to become familiar with that document. Again, a call out to put yourself on the map. So this is our QPS network map. It helps to know where you are and for you to know where other people are who are interested in quality improvement, and who could be helpful to you in terms of projects or sharing ideas. And so get yourself on the map. We can then connect you with other people. Again, Q and the Q community is something that we really want to encourage people to join. Now, you know, if you're a Q member already, then you can't join again. So your task, I think, if you're already a Q member, is to get somebody else, you know, to get interested in Q and maybe to think about joining Q. And the same if you're on the quality improvement map and you know somebody who's not on the map, then you know the task is to encourage those people to put themselves on the map, at least make them aware of it, and then encourage them. So again, Q, I think well worth joining. Q Exchange has now been released. This is a big research fund of up to £40,000 to kind of really be startup, you know, for quality improvement projects, or to accomplish, you know, small projects in and of themselves. So please do check that out, and that will be a voting system as well. So it's worth kind of keeping an eye on that, because Q members get to vote on the projects which are successful for funding. So we'd encourage you to take an interest in that, and you might find people who are putting forward Q Exchange proposals might want to get the Irish Q community behind their proposal, because their votes will matter. So keep an eye on that, and we'll keep you updated on that. Patient Safety Together, this is our new website, and again, just really encouraging people to become familiar with it, check it out. There are many great resources there around patient safety alerts, patient safety stories, and I think you'll find that is also a resource that is going to be developed further in the months and years ahead. So please do check it out and become familiar with it. Our next sessions then, we've got 2 sessions later on in March. In 2 weeks' time, we have John Brennan, who's a GP and my co-faculty at the postgraduate certificate at the RCPI. And John is going to engage some guests really to talk about working in the community and bringing quality improvement and making patient safety happen in the community. So again, if you've got colleagues or friends who are working in the community, this might be a session that's particularly interesting to them, but I think there'll be something there for everyone. So that's on the 21st of March. And then on the 30th of March, we have a special QPS talk time where we are going to come to you live from the International Collaborative Workshop with the Department of Health, and we will also be bringing you some of the executives from ISQA, the International Society for Quality in Healthcare, and so we'll get to talk to Dr. Orla Healy, the National Clinical Director for QPSD, Rachel Kenna, the Chief Nursing Officer, Professor Jeffrey Braithwaite from Australia, who's the current ISQA President, and Dr. Ezekiel Alorio, who is the President-elect. So I think that'll be a really interesting session, and I think you'll get to hear, you know, both national and international perspectives. Finally, just keep connected with us. So there's our Twitter presence at QPS TalkTime, and our YouTube channel is there, which you can watch back some of the QPS talk times that we've had. Now, I just watched the one with Tom Foley the other day, the one we had 2 weeks ago, and actually the quality of the recording is excellent, I must say, and I think it's a really good session. So if you want to tell people about learning health systems, I think you could direct them to the presentation and the discussion with Tom afterwards. And going back for the last couple of years, there's lots of recordings there as well on previous guests that we've had. And finally, just to thank you all for being here, I want to remind you, and please, would you fill out your feedback, give us some feedback, because we will take it on board and we'll use it to build our next sessions. A big round of applause for Juanita today, I think, for nudging us all to do something new, and very much taking us out of our comfort zone and trying something as ambitious as this. And I think from all the feedback there, it's been great. It's great to interact with the audience. You know, the chat is good, but I think you know, getting out to really meet people and to be able to have discussions is a real triumph of technology. So she's put a tremendous amount of work into it, and well done. And thank you to all the rest of the team, Chris and Shima and everybody who helps to make QPS Talk Time happen, and Maureen. So we will see you in 2 weeks' time, folks. Thank you very much.